I'd like to talk to you about ankle sprains because they're a very common injury in sports, but even just walking down the street, you can roll your ankle and sprain your ankle. And there's first, second, and third degree ankle sprains. The most common ligament that is sprained in the body is the anterior talofibular ligament, or we shorten the name and call it the ATF. And the reason it's so easily sprained is when we go into inversion sprain, or when the ankle rolls to the outside, it can tear this ligament and it causes a lot of pain, swelling, discomfort, and sometimes pain with weight bearing even. So you want to keep that very protected when it's in the acute phase. And we use the acronym RICE: rest, ice, compression, elevation. And all of those four things are going to be very important in the first stages of an acute ankle sprain. A more severe ankle sprain, you want to seek medical attention, consult with your physician, and they may want to put you on crutches to get you non-weight bearing so that the ligament has time to scar down. And that's true of an acute minor sprain too. For the first 2 to 3 days, you want to rest it, ice it, elevate it, compress it. And what we use for compression are ankle sleeves, or this is a little bit more involved. It has straps that go around and really keep the ankle protected. But even more protection is this is called an air cast, and it really confines the ankle so that there's relatively no movement at the ankle when you're walking. Okay, and now I'll show you how this goes onto the foot. So what you do is you place your foot right into the air cast, and the bubble portion of the air cast goes right around those protruding bones around the ankle. And then you just use the Velcro straps to wrap it up securely. So it's very stable, and then you can weight bear without a lot of movement to the ankle joint, allowing for more scarring of that tissue so that it becomes a very functional joint. Now again, I'm going to demonstrate how to put this on a real foot. So I'll place my foot right onto that center portion, and then these cushioned areas will go right around what are called the malleoli, or the bones protruding right at the ankle. And so you wrap that around nice and snug, and then you put the Velcro right around. So it's very simple to do on yourself. And this allows for that stability to the ankle. Make sure it's nice and snug. And now that feels like there won't be any movement, but I can still walk. And it feels nice and secure. Now, if it's more than a first degree ankle sprain, then again, you want to check with your physician, and they may want to get you non-weight bearing for a short period of time until the ankle heals. If it's a full rupture and you get more than just the lateral ligaments involved, definitely seek attention from your physician. For athletes who've sustained an ankle sprain, but they still want to maintain playing their sport, you can use this brace called the ASO brace, and I'll demonstrate how to put it on. So it goes right on your foot, just like you would put on a shoe. And you could put it on gingerly if you're in some pain. You tighten up the strings, tie the shoestrings, just like you would a shoe. And then these straps are the most important part. You cross right in the middle, in front of the ankle, go underneath the foot, and then it has a Velcro to attach here. And you do the same exact thing, but opposite direction. Cross right in the middle, so it makes this nice cross right in front of the ankle, and then come underneath the foot, make sure it's nice and snug, cross it, and then close it up at the end. So this is just a Velcro strap that you close up at the end, so it's nice and secure. And then you can place your cleat on, or your shoe, your athletic shoe, and you're good to go. It just keeps you really secure, similar to what a taping technique can do for you if you have an athletic trainer to tape you. But this is a nice, secure, more stable position for the ankle.